It's Kara with Reaching Out. Today's topic I want to discuss is post-traumatic stress disorder. Post meaning after, traumatic or trauma meaning an event that has totally knocked you off your kilter. Stress, mental tension, and it can be physical tension as well. Disorder is something that affects your psychological being. So many years, when we hear post-traumatic stress disorder, we associate it with soldiers and U.S. Armed Forces. Recently, in the last 2 or 3 years, I have discovered that post-traumatic stress disorder can affect anyone, any age, any gender, any culture. Post-traumatic stress disorder, or PTSD as it is known, is a result of being a victim of a traumatic event. And suffering loss. A traumatic event can be anything from surviving a flood, surviving a tornado, which there have been many this year, going to war, and losing someone that you love, whether it be someone very close to you that passed away, or someone that was taken from you, and there's so many different ways they can be taken. They can be taken by death, kidnapped, anything. How you can be diagnosed with post-traumatic stress disorder is if you have recurring nightmares, recurring thoughts, recurring memories of the traumatic event or the person in the traumatic event. And those mechanisms don't allow you to function on a normal basis as you did prior to the event. PTSD can cause depression, anxiety, anger. Kind of goes along with grief, in my opinion. It's kind of like the same process. You know, you have denial, and you have anger, and then you have acknowledgement and acceptance. With PTSD, you can become depressed, which can lead to other issues. As in drug and alcohol abuse, or physical abuse of those around you, verbal abuse of those around you, because your mind is not functioning in a normal manner. Meaning that you're always looking not for fault or blame or anything like that, but to have PTSD, it means that something in your normal everyday life can happen, and something about it reminds you of the traumatic event. So you're thrown off kilter. You're automatically assuming that something bad is going to happen again. That's the anxiety. For instance, in my experience, with my son being hit by a truck and killed instantly, whenever I hear of that happening to somebody else, it just reminds me of Jordan's incident. And it brings up all those feelings and those emotions of what I went through at that time. So that I'm constantly reliving Jordan's incident over and over and over again, and it brings up all those feelings again. Or when I'm watching a movie and they show somebody get ran over, it's just a flood of emotions. Like on Army Wives this year, Jeremy Sherwood got killed in Iraq. No, my son didn't get killed in Iraq. But for I don't know how many weeks, they concentrated on Major Sherwood's and Denise's son's death. And the one line that sticks out in my mind, and I had to actually walk out of the room on, was when Denise said, "Roland, my baby boy is dead." And it just, it went right through me. I couldn't handle it. And it took a lot for me to be able to watch that program after that, because I was afraid that they would talk about his death more, and I didn't want to hear it. So it's little things like that, you know, that can bring up the memories. And with PTSD, when you can't let go of those memories, not the good memories, I'm not talking about that. I'm talking about the memories of the actual event, not the memories of the person. The memories of the event that took place, that robbed you of something and affected you so much that you can't function, that's when it's PTSD. Now, depression is a part of PTSD. And mine was severe because of the tragic loss of my son and the tragic way he died. Depression set in bad because of not only his death, but I felt like a failure as a mother. I felt like I should have done something different. I could have done something different. And there's that guilt, which they call survivor's guilt. If you have survivor's guilt or a traumatic event, that can trigger the PTSD. But what's important with PTSD is getting diagnosed as early as possible before someone gets deeper and deeper into it and possibly reverts to drug and alcohol abuse, which is very common in PTSD, because the person turns to those things to mask the hurt and pain that they feel, to mask those emotions and the anxiety and the depression that they feel and are dealing with. They turn to alcohol and drugs to take that away, even though when the effects of the alcohol and drugs wear off, you're right back there where you were before. So in order to get through PTSD, it's very important to seek out therapy or counseling. And I suggest along with that, some type of support group, you know, like grieving parents or AA or anything like that, you know, that you can reach out to others that have been through the same thing that you've gone through. Because those people understand. They're not going to be judgmental about what you're going through or what you're doing in order to deal with it, to deal with the event. Those people are going to be the last ones to judge it. and they may have some information or some type of outlet that they do that could help you, and vice versa. That's just like me starting the Grieving Parents group page on Facebook. You know, it's to give inspirational quotes or sayings or ideas to other parents that have lost children. I hope and I think that I've helped some people, you know, or just to give them an understanding that they're not alone, you know, that what they're feeling is okay. But it's a support group too, because if somebody asks me, you know, what can I do to change this or prevent this, I'm going to do what I can to give them some information. If I don't have it already, I'm going to research it.